Pharmacodynamics. When finished, students should be able to define pharmacodynamics and describe how it relates to drug dosing. Describe the lock and key mechanism of the drug receptor binding. Differentiate between drug potential and efficacy in terms of dose responses. Explain common drug receptor interactions and describe considerations for drug dosing. The mechanism of action. The way a drug works at the target tissue is its mechanism of action. Most drugs exert their effects, both beneficial and harmful, by interacting with specialized target macromolecules called drug receptors that are present on or embedded in cell membranes. Reaching a drug's intended effect involves a complex interaction of the drug's binding to a receptor and the chemical interaction between the drug and its target. These interactions affect how a drug binds to its receptor on the cell surface, which affects the signaling of subsequent processes in the biochemical process. A drug receptor is a specialized target macromolecule situated on the outside of a cell membrane, embedded on the cell surface or within the cell membrane, or located in the cellular cytoplasm. Some examples may include enzymes or nucleic acid. They may involve cells with different types of receptors binding with more than one drug. The drug may bind to the receptor, which is determined by the drug's chemical structure and reaches a therapeutic effect via select receptors. The ability of a drug to bind to a receptor is determined by the drug's chemical structure of the drug. The drug-receptor interaction is the key to the ability of the drug to facilitate its physiological effect. The drug receptor binding. The binding site is where the drug binds to the receptor. There is a three-dimensional shape, structure, and reactivity of the binding site. Although the molecular shape of the drug and the receptor is important to its interaction with the drug, there are clinically important aspects of drug receptor binding, specifically the lock and key mechanism, that are important. The lock and key mechanism of the drug receptor interactions. Most drugs work much like a key opening a lock. A drug, like a key, has a complex shape that determines its function. The drug binds to a receptor as a key with entering a lock and creates a response, as in opening the lock. Molecules such as drugs, hormones, and even neurotransmitters that bind to a receptor are called ligands. These molecules activate or inactivate a receptor and increase or decrease the function of a particular cell. A ligand must interact with multiple receptor types. However, most drugs have relative selectivity. The combined drug-receptor complex unlocks the drug to act on the target tissue. Once the drug-receptor complex is created, it produces alterations in biochemical or molecular activity of a cell by a process called signal transduction. The binding of a drug to its receptor can be reversible or irreversible. Reversible binding occurs when the drug can separate from the cell receptor, as removing a key from a lock. When the drug is removed from the receptor, the effect of the drug stops. Irreversible binding occurs when the drug is not able to separate from the receptor, which prolongs the drug's effect. The dose-response relationships. With gradually increasing or graded doses, there are generally greater magnitudes of responses in an individual patient. As the dose increases, there is an increase in the percentage of the population affected by the drug. Eventually, there is a lethal dose of a compound that is determined experimentally. Usually, this is determined by administering a chemical to mice or rats. The lethal dose 50 is the dose of the drug that is lethal in 50% of the population. The effective dose of a drug is the concentration of the drug at which 50% of the population will have the desired therapeutic response. The therapeutic index or therapeutic ratio quantifies the relative safety of a drug. The therapeutic index or the therapeutic window is calculated with this equation. The therapeutic index is equal to the lethal dose divided by the effective dose. Clearly, the higher the therapeutic index ratio, the safer the drug. Drug receptor interactions. Many receptors for drugs can be modeled as having two conformational states or shapes that are reversible, equilibrium with one another. These are called the active state and the inactive state. The pharmacological properties of the drug are often based on their effects of their state of the receptors. A drug that, in binding to its receptor, favors the active receptor is an agonist. A drug that inhibits the receptor by blocking agonist induction, the receptor is an unbound and available for binding. A receptor is unbound and available for binding. The agonist activates the receptor by inducing a conformational change in the receptor. For example, the opening of a transmembrane ion channel. The agonist can also function as inverse or partial agonists. The competitive antagonist blocks the agonist from binding to the receptor by binding the receptor's agonist site without activating the receptor. And the non-competitive antagonist, it binds to the site different from the agonist site, the allosteric binding site, thus preventing the receptor activation even when the agonist is bound to the receptor. An agonist is a drug that produces the desired physiological effect in binding with the receptor. When bound by an agonist, most receptors are activated by stabilizing the receptor in a specific shape or conformation. The inverse agonist binds to the same receptor as an agonist, but induce a pharmacological response opposite to that agonist. Partial agonists bind to and activate a receptor, but only have partial efficacy relative to full agonists. The antagonist is a drug that either diminishes or prevents the physiological effect of the agonist, but has no effect on the absence of the agonist. The pharmacological antagonism occurs when the antagonist binds to the receptor and prevents the biological effect of the agonist. The antagonist can either be competitive or non-competitive and can bind reversibly or irreversibly. A reversible antagonist is readily disassociated from the receptor. Irreversible antagonists form a stable, permanent, and nearly permanent chemical bond with their receptor. Drug dosing. Medical prescriptions are based on their characteristics of their drugs, such as the indication, efficacy, safe profile, route of administration, route of elimination, dosing frequency, and cost, and of the patient, such as their age, sex, other medical problems, likelihood of pregnancy, ethnicity, and other genetic determinants. The risks and the benefits of the drug are also assessed, and it is important to note that every drug possesses some risk. Whether a drug is indicated for an individual patient depends on the balance of its therapeutic benefits and adverse effects. In making such judgments, prescribers often consider factors that are somewhat subjective, such as personal experience, anecdotes, personal practice, and expert opinions. Prescribers may use several methods to design dosage regimens. Generally, the initial dosage of a drug is selected based on the following patient factors, such as known diagnosis, pathophysiology, demographic, allergy, and any known factor that might affect the patient's response to the dosage regimen. Adjustments to the patient's dosing may be needed or indicated as the patient continues the medication. Dose responses. A drug's affinity is the measure of how tightly the drug binds to the response. A drug's affinity is the measure of how tightly the drug binds to the receptor. Likewise, the drug's intrinsic activity is a measure of its effectiveness in generating the intended change of a cellular activity. Selectivity is the degree in which a drug acts on a given receptor, both relative to the other available cellular receptors. Both the affinity of a drug for its receptor and its activity are determined by its chemical structure. The chemical structure of a drug also contributes to the drug's specificity. A drug that interacts with a single type of receptor on a limited number of cells exhibits high specificity. One example of a drug that interacts with multiple receptors is amiodarone, an agent used to treat cardiac arrhythmias. The risk of broad specificity is adverse side effects. This is figure 5.5. These tables indicate relative potency and efficacy of two hypothetical drugs. The dose response. Potency and efficacy are often confused. Potency is the term used to compare the different dosage of two medications in producing the same effect. On the other hand, efficacy is the strongest effect a drug can produce. Drug responses are quantified by determining the half maximal effect concentration for producing a given effect. Vancomycin is a common medication for choice for the treatment of methicillin-resistant Staphylococcus aureus, or MRSA. Therapeutic drug monitoring, or TDM, is critical for ensuring this drug's efficiency and safety. Excessive use of vancomycin can result in hearing loss or acute kidney damage, necessitating regular monitoring starting within the first 48 hours of administration. The concept of therapeutic drug monitoring is important for the athletic trainer caring for competitive athletes with MRSA because highly motivated athletes sometimes opt to self-medicate under false impressions that this can accelerate their healing, under the impression that sometimes more medication is better. Pharmacodynamics of opioids. Pain is a complex condition to treat pharmacologically with opioids. Some opioids transfer rapidly or slowly between the plasma and its target site. Their strength is classified as high or low potency. The analgesic effect of codeine, a low-potency opioid, is predicated on its biotransformation to morphine in the central nervous system. Approximately 10% of oral codeine is converted to morphine by the cytochrome P450 enzyme system. Oxycodone is high potency and works peripherally with the mu-opioid receptor, and it's effective when there is no delay at the site of action. Metabolites of these medications, such as oxymorphone and noroxymorphone, also contribute to the analgesic effects of opioids. Drug potentiation. Drug potentiation results when one drug interacts with another, causing a greater pharmacological response than the drug would have independently. Warning labels associated with prescription drugs are intended to alert clinicians and patients to the prospect of inadvertent interactions. For example, it is commonly known that alcohol magnifies the sedating effects of medications. Less common, but still a significant concern, is the potential of increased bleeding risks associated with nonsteroidal anti-inflammatory drugs, or NSAIDs, are combined with an anticoagulant. The risk of a drug potentiation is an additional reason why healthcare providers should be familiar with the medications their patients use regularly. In summary, pharmacodynamic effects of the drugs on the body. They give the athletic trainer greater understanding of the drug-target relationships and enhance the understanding of the drug-receptor interactions. They are fundamental relationships of the drug and receptor or lock and key mechanisms. And athletic trainers need to have better understandings of how Athletic trainers must have better understandings of how drugs establish therapeutic effects relative to their adverse effects.